Ozempic costs 10 times more in the United States than in the rest of the developed world. 10 times more. Why? Why? What did we do? Drugs and pharmaceuticals are going to be down 70, 80%. It's going to be very interesting. First, I'm directing the U.S. trade representatives and Department of Commerce to begin investigations into foreign nations that extort drug companies by blocking their products unless they accept bottom line and very low dollar amounts for their product, unfairly shifting the cost burden onto American patients. And we'll be taking a look at that very strongly. The biggest thing we're going to do is we're going to tell those countries, like those represented by the European Union, that, that game is up, sorry. And if they want to get cute, then they don't have to sell cars into the United States anymore. It's a very big subject. And they won't get cute. And if necessary, we'll investigate the drug companies, and we'll, in particular, investigate the countries that are doing this, and we will add it onto the price that we charge them for doing business in America. In other words, we'll add it onto tariffs if they don't do what is right, which is everybody should equalize. Everybody should pay the same price.
President Trump is saying to our European partners, is you've got to raise the amount that you're paying for those drugs and pay for your share of the innovation. That the United States is no longer subsidizing that. If the Europeans raise the price of their drugs by just 20%, that is $10 trillion. That can be spent on innovation.
We want innovation. We want our technology partners doing the best they can to make the best solutions for drugs to cure as many people in America and around the world as possible. By getting our allies to pay a bit more, as they should be, and they should have for many years been doing, we'll course correct a problem that's gotten out of hand.